There is no doubt that when a child presents with epilepsy, the result of HH, they would undergo an endocrine assessment. They should have an endocrine assessment. You would expect that this is an abnormality of the hypothalamic pituitary axis, and therefore we know these children be at risk of problems. That aside, there seems to be two ways of presenting. Those with precocious puberty don't appear to have as a high risk of presenting with epilepsy, and likewise those with epilepsy, they don't have a high prevalence of precocious puberty. And indeed, when you examine these children with epilepsy as a presentation, although precocious puberty may be seen, other endocrine disturbances are on the rarer side. They don't tend to happen unless there's an active intervention, such as surgery, when they are at high risk of developing a problem. So although we will assess them, families shouldn't expect that they will have endocrine problems without a surgical intervention if they're presenting with epilepsy. The endocrine side effects for which they're at risk of, should there be a surgical intervention, and the risk will vary according to what kind of surgical intervention, are diabetes insipidus, which is where there is a shortage of ADH and antidiuretic hormone, and therefore they have a fluid balance problem and low sodium. That, more often than not, is transient after intervention, but may not be. Problems with cortisone, steroids. There isn't the ability to produce your own steroids in times of stress, and therefore you may need supplementation. There's the issue of thyroid hormone, required again for day-to-day activity. And then there's also obviously the sex hormones that we've already talked about, and whether they run into problems with that.